In the previous sessions, we have talked about the different films recording devices, both used in the intraoral as well as the extraoral techniques. And today we'll be talking about one step ahead or an advance in these recording devices, that is your digital imaging. So what do you mean by digital imaging? You must be having a general idea as to digital imaging relating itself to a kind of soft copy of the actual traditional or conventional kind of films, wherein the digital meaning, the meaning of the word digital has a two-pronged effect. Now what is that? Now basically what digital imaging does is it is used to capture the image of particular interest via a digital sensor and breaks this particular image into different parts or small boxes called as pixels. Now these boxes, each box represents one particular part and one segment of the image, which is then converted into a digital signal, which is in the binary format or a numeric format, and then represented onto a system. So what does this word digital mean? Now digital itself means the numeric format of the image. Now as I told you, these breaking up of this image into different boxes or pixels, and each particular picture or a pixel is represented by a binary format or a numeric format, which is directly proportional to the intensity of the lightness or darkness of the image. That is to say, a numeric format or a numeric number is represented or given to a particular pixel depending upon the degree of lightness or darkness. Now combine all this lightness or darkness numerics, you get the entire picture, which has both the radio opaque and the radio lucent areas and the different shades of gray. Now what the other effect or the other meaning of digital is a discreteness. Now as we know, a numeric or a number is discrete in its entity. In the same way, this particular image, which is converted into an electric signal via breaking up this image into small boxes. So each box is represented as a whole in itself. Now combination of all these boxes represents a total picture. So each particular pixel has a particular signal, has a particular input and an output value. So it is discrete in nature. So these two effects is related, or it is meant, or related to the word digital, which we use in digital imaging techniques. So as I told, it is a method of capturing this radiographic image using a sensor into electronic pieces. The main important points you need to remember over here is breaking up the image into small pieces of pixels represented by an electronic signal and then converted into a final picture. So what are the different types of digital imaging? Now we have two different types of digital imaging. One is a direct imaging, direct digital imaging, and the one is an indirect or the traditional kind of imaging. Now a direct digital imaging, as the word suggests itself, directly it absorbs or takes in X-rays, converts them into electronic signals into binary or numeric format, and then represented upon the system as a digital image. Now among this we have your CCDs and CMOS. Now CCD is nothing but charged coupled device. This is one of the most traditional and the conventional type of digital imaging, direct digital imaging. Now CMOS is the next step ahead of CCDs, which is also called as complementary metal oxide semiconductors. Now this is one step ahead with few advantages over CCD, which I'll be talking about later. Now the indirect or scanned digital imaging is more of a direct traditional or a conventional kind of a digital imaging, wherein you take your traditional kind of images using X-rays and hard copies, and then scanning these traditional radiographs so that we can conserve its properties or image characteristics for a long time. We can transfer these digital images via soft copies to other specialists or physicians, so that time dependent loss of image characteristics is negated totally by scanning these traditional radiographs. Now apart from that, we have also PSPs, which is also known as photostimulable photoconductors, phosphors. So this is PSPs, which is the other kind of digital imaging, which is also a kind of indirect digital imaging, wherein the process, which I'll be talking about a little later. So CCDs, now as I told, this is the first and the foremost kind of digital imaging, a direct digital imaging, which was the pioneer invented right back in 1987. Now what we have over here is various arrays or arrangements of various pixels or light sensitive boxes. Now this pixel which I was talking about, the box which I was talking about, the discrete nature which is attributed to digital imaging is all related to this pixels, which is nothing but a box of information. So these are light sensitive pixels. These directly take in X-rays and convert them into electronic signals. Now this being the first and the foremost or the pioneer kind of digital imaging, it has its own share of disadvantages, but the main working is it can be seen in this schematic representation. It's basically usage of a semiconductor, like a silicon semiconductor, which has both the N and the P terminus. Now the total schematic representation, as you can see over here, the electrodes, which basically converts this image or the X-rays, information from this X-rays into electric signals, and then projected as a soft copy or as a digital image. Now the N-type and the P-type silicons, which are the basic forms the basic crux of the CCD material or the sensor. Now we have the insulating layer, and we have the scintillator, which is receptive to these X-rays and converts them into light signals. So this is basically a phosphorus material. Normally the most commonly used scintillator here is gadolinium oxybromide, which is a rare earth metal. So these metals have the properties of absorbing X-rays and converting them into light signals, and these signals and then transmitted across the semiconductors and then transferred onto the electrodes, which is then receptive to these light signals. Depending upon the intensity, we have the particular binary format and then represented as a digital image. We can see the peak voltage. We can see at the junction of this N and P semiconductors, at the junction of these N and P terminals, we have the peak charge potential. That is where all the image information is stored temporarily before being passed on to the electrodes. We can see how, coming from the right to left, it is at this junction wherein it is a peak charge potential is found over here. So how the image is formed? So as I told, this is a direct kind of digital imaging wherein it takes in directly the X-ray photons and converts them into light and then into electric signals. As you can see over here, the incident X-ray photons is first taken by the scintillators, which is a gadolinium oxybromide, which I told you about. It is converted into light signals. Now these light signals are then transmitted along the silicon semiconductors across the P and the N terminals. At the junction, we have the formation of charge packets, which is nothing but a collection of this energy packets, which is basically the amount which is directly proportional to the amount of X-rays which is incident at that particular point. So say a specific point has a greater amount of X-rays which is coming over to that particular point compared to the surrounding areas. This particular energy is stored in a kind of packet or charge packet, which is then transferred across the whole length of the semiconductors, silicon semiconductors, stored temporarily at the NP junction, as you can see over here, which is the pixel boundary, charge packets, and this is detected by the electrodes. Now then, after this detection of electrodes is done, the final step in digital imaging, that is your ADC, that is your analog to digital converter. Now these basically are analog signals. Your light signals are basically analog signals. Now this ADC helps to convert this analog signals into a digital image by using numeric format or a binary format. Now as I told you, each pixel is directly proportional to the amount of energy which is incident upon the sensor. Now this is directly assigned a particular numeric number depending upon the different shade of gray which is represented. Now this, and then this numeric format is read out by this converter into a digital signal. Now CMOS, on the other hand, it is basically similar to CCDs in the whole structure or the function and how the signals are read. The only difference is the way in which these pixels read the incident signals. Now as I told you over here, it is a bucket brigade kind of carryover fashion. That means to say the information which is incident upon the outer exterior of the silicon material at the junction of the scintillator. Now this information or this charge packet is transferred to the across the whole length via bucket brigade fashion. That it jumps over subsequent silicon materials or molecules, and then it is transferred across the whole length to the junction of the NP semiconductor, which is then read out by the electrodes. But this is not the case with CMOS. CMOS, what happens is each particular pixel is directly connected to a electrode. That means to say each box or light packet or a charge packet is directly attached by a kind of wire, you can say. It is connected to the electrode. So what happens over here is there is no loss of image characteristics across the whole length of traveling. Now in this particular CCD image formation, there's some amount of image loss which is concurred because of the way in which this packet's energy is read out by the electrodes. Now the transfer of this charge packet across the whole length diminishes some amount of energy within the charge packet. Thereby the electrodes do not read the total extent of the X-ray energies which is incident upon the semiconductors. But this is totally negated in CMOS, wherein since each particular surface charge packet is directly attached to the electrodes, there is minimal amount of image loss. So the images are much more sharper, much more clear, without any graininess. So that was to overcome this particular disadvantage of CCDs. CMOS was then invented. Now compared to CCDs, CMOS sensors are slightly thinner, more flexible in nature. So as I was saying, the sensors which are used in CCDs are much more bulkier in nature, and it is more difficult to place in the interval cavity. Also the vertical placement is even more difficult because of the bulkiness of the sensor. Also the actual image receptor area within this bulk of image actual sensor is much more smaller than the actual area or the instrument in hand. So there were more chances of image loss or cone cuts because of the lesser amount of area wherein it actually records the image. So to overcome these particular disadvantages, CMOS was invented, wherein the area was much more wider than your CCDs, and without compromising on the bulkiness. So it is much more thinner and flexible, easily placeable, much more easily placeable relative to CCDs within the interval cavity. Now the next indirect kind of direct digital imaging, that is your photostimulable phosphors. Now as the name suggests, it is photostimulable phosphors. So photons, that is your light, is stimulating some kind of a phosphorus materials within the sensor and then producing an image. Now that is the basic functioning of PSPs. Now the total functioning of PSPs can be read out in this particular flowchart. It first absorbs the X-rays, the incident X-rays, whatever area of interest we are taking, depending upon the intensity of X-rays. It is stored, this sensors absorb this X-ray energy. It stores this particular X-ray energy temporarily in its sensor, depending the area of storage. Again, it is directly proportional to the incident X-rays at that particular point. So it absorbs energy and stores energy temporarily, and then it is activated, or in other words stimulated. Now how it is stimulated? The name suggests it is photostimulated. That is, light of a specific wavelength is used to stimulate this particular sensor, which already temporarily stores the amount of energy which is incident upon it from the specific area of interest. Now upon this stimulation, there is release of this energy. And how is this energy released? It is released via light of different wavelength than which was incident upon it. Say we are activating or stimulating this kind of sensor with one X kind of wavelength. Now upon a stimulation, the energy which is stored on a temporary basis within the sensor is given out as light again of a different kind of wavelength, say about Y wavelength. Now this is then read out by the transistors or a photomultiplier tubes So this is basically light which is coming out. So it basically magnifies or it multiplies the signals of light which is coming out from the sensor, and then relative to the kind of amount of energy which is coming out, amount of light which is coming out, it is then converted into a digital signal, and this specific areas of brightness or darkness is then shown as a different shades of gray on the digital image. So the material which is basically used, the phosphorescence material, which is the ability of one particular material to absorb light of one specific wavelength and then give out light of different wavelength, that is your property of phosphorescence, is used over here. The most common material used is europium doped barium fluorohalide. Now this is a schematic representation of the PSP photostimulable phosphorus sensors. Now it has a protective barrier against infection control. The main phosphor layer, which has a property of phosphorescence, your europium doped barium fluorohalide, and then the reflective layer and the conductive layer, both of them basically used for increasing the image sharpness and decreasing or minimizing the amount of image loss. Now we have the basic support which gives strength to this whole phosphorescence layer and the other layers. We have the backing layer and the barcode layer. Now this barcode layer is basically receptive to the amount of light, degree of intensity of light at specific areas, which is then converted via photomultiplier tubes from analog signal to a digital signal. Now the image formation, a schematic representation, you can see the phosphor layer, which was europium doped fluorohalide, barium fluorohalide. You can see the europium, which is basically increases the sensitivity of this particular sensors to incident signals. Now upon activation, when the plate is exposed to X-rays, this europium converts itself into europium plus 2 into plus 3. That means to say it loses out an electron because of the incident energy of the incident energy attributed to the X-rays. Now this electrons then jumps into the conduction layer, conduction band, into an epicenter, which is a kind of electronic well, which is a storehouse, a temporary storehouse for the electrons which are released out from the europium base. Now since it is a semiconductor which is used over here, the conduction band, the electron directly jumps into the conduction band into the epicenter and is stored temporarily over there. So this amount of electrons, the number of electrons which are stored in a particular well, that is your epicenters, is directly dependent upon the incident X-ray energy. So it means to say areas wherein more amount of energy is incident, we have more number of electrons jumping into the wells when compared to areas which receive less amount of X-rays. So this, when subsequently activated, predominantly a scanning laser is used which emits light of particular wavelength. It activates or removes these electrons from the epicenter placed within the conduction band back into europium and converts europium plus 2 plus 3 black to plus 2. So this conversion process, wherein an electron from the higher energy levels is coming back to its lower energy levels or a more stable levels, this loss of energy, the degree of loss of energy, which is directly proportional to the incident X-rays, is given out as a light of a specific wavelength, of a different wavelength. Now this specific light signal, it is minimal in amount, so it has to be multiplied, which is done by the photomultiplier tube, and depending upon the signals we received from the various the whole of the sensor, it is then processed and the final digital image is produced. Now this is you can see what I was talking about, the sensor thickness. Now there's Cygnus, which you can see over here from Cygnus Technologies from Arizona, that is your CCD sensors, which are very much thick and bulky in nature. You can see 7 mm thickness of a single sensor. Now then we have this Schkick from New York and a Trophy from Danberg. Both of them are CMOS receptors, which are much lesser in thickness, as you can see over here, 5. And the best or the most thinnest and the most flexible and easily used is your PSP sensors. As you can see, Dynoptics from Illinois, that is just about 1 mm in thickness. So it is almost equivalent to the traditional kind of films which we use, with barring the disadvantages of using a traditional or conventional radiograph. So if you compare the intraoral receptors, your normal films, your traditional IOPR films, your CCDs and PSPs. Now we have eliminated CMOS since it is almost similar to CCDs, just apart from the fact that it is slightly thinner than CCD. We can see the radiation dose, which is very much high in normal films. That is one of the most primary advantages of using digital imaging, wherein the radiation dose per film for a patient is reduced by 80 to 90%, which is much more beneficial to the patient and the physician both alike. So there is lower amount of radiation dose using digital imaging. We have your generation of visible image, that is via chemicals. You have your developers, fixers, the whole lot of liquid mess which we have to go about to develop a traditional film. Now that is totally eliminated via CCDs, which is computer generated or laser scanned, much more easier and less hassle free. Now we have the image viewing, normal view box. Now we have the computer monitors over here. Now we can see the infection control. Again, we have the barrier covers and the film barriers. So that is basically the different differences between the traditional and the digital imagings. Now another most important advantage is your image enhancement. Now with your traditional or conventional radiographs, we have no chance of modifying or manipulating this image, be it the brightness or the contrast or whatever kind of image characteristics we want to modify for better viewing, that we cannot do it with a traditional IOPR films. Now that is again totally negated in digital imaging, wherein many number of tools, starting from brightness or contrast or double image or replacement image, many kind of tools can be used in digital imaging so as to increase or enhance the diagnostic properties of that specific image with a lesser amount of radiation dose. And the other one will be your storage. Now we know these are hard copies or whatever traditional images which we radiographs which you take. The storage is one big problem, wherein there is loss of image characteristics as time goes by, which again is not a problem with digital imaging. It can be stored as a soft copy for any length of time, and it can be easily transferred over to other physicians without any loss of image characteristics. Now after the image is totally taken up by the ADC, that is the analog to digital converter. Now these digital signals have to be displayed on some kind of monitor so that we can read out this total image. Now that is done by two ways. Your more conventional kind, that is your CRTs or cathode ray tubes, which is the most conventional kind, which is you can normally see in your old time TVs or desktops, which is a mechanism which uses this ADC conversion. The main problem with CRTs is the space occupying. It is much more bulkier, much more not very easy to use. Now there is also image loss while this analog to digital conversion takes place. The image readout is primarily done by two different ways, your CRTs and your TFTs. Your CRTs is nothing but cathode ray tubes, which is the most conventional, the traditional kind of readout displays, which is more found in your old time TVs or your desktops. The primary disadvantage with that is your bulky nature of this monitor display, and the ease of use is much more lesser when compared to TFTs. And one of the other most important disadvantages is your image loss, which is primarily seen in these kind of cathode ray tubes, wherein there's some amount of loss of image characteristics during the process of conversion from analog to digital. Now these disadvantages were overcome by TFTs, which are much more recently used. They're your thin film transistors. So what is done, as the name suggests, it is much more thinner in nature. less space occupying, less it is hassle free, and the most important advantages is no image loss at all. There's absolutely minimal or 0% image loss. So the image characteristics are exactly replicated during the process of analog to digital conversion. The only problem being your higher power consumption. So what are the advantages of digital imaging? Why do we have to use digital imaging? So I've already listed few of the advantages of using this. Now we can just go through. Immediate observation of radiographic images. Obviously, since we are doing away with the chemical processing of developing or fixing the radiographs, it is an immediate production of the image. As soon as the image is taken, we can easily see the digital image onto the screen or your monitor. Since no chemical conversions is needed for this kind of digital imaging. The other one is ability to enhance images. As I told you, there are various number of tools which are available in digital imaging, starting from your brightness or your contrast or your zoom in or zoom out or scanning abilities or reverse contrast, image enhancement. All these different tools which cannot be used in a traditional radiograph can be easily used by a person with minimal amount of computer knowledge to enhance these images, hence increasing the amount of diagnostic quality from the specific image. Now, data storage, as I told you, these are basically soft copies. Now, the soft copies can be stored for any amount of time, any length of time, without any problem for worry about any amount of image loss or image loss dependent upon the time. So this it can be data storage. As I said, it is you can do away with the chemicals totally. Communication with practitioners. Now, since we are using a soft copy, which is the basic mode by which these images are displayed upon, it can be easily transferred via JPEG files or TIFF files and can be sent to other practitioners without any worry again for image loss or damage or destruction to the image properties by sending these soft copies. Lesser radiation, as I told you, there is 80 to 90% reduction in the radiation dose for a single exposure. That is one of the primary or the foremost of all the advantages of digital imaging. Now, lesser loss of image quality, as I told you, since it is stored in soft copies, there is no problem of image quality reduction. And ease of use. Now, we expose the sensor, we get the image. There is absolutely no time loss or no lengthy chemical processes, so it is easy to use when compared to normal radiographs. Now, saying this, we also have few disadvantages of using digital imaging, wherein we sometimes feel that traditional radiographs is much more better than digital imaging. Cost intensive. Now, these sensors are highly expensive. There's the initial infrastructure which is needed for digital imaging. The initial investment which is needed is much more higher than your traditional radiographs. That is one main disadvantage of lack of widespread use of digital imaging. The cost of converting previous records to digital, if required, to convert all the normal digital images into normal traditional radiographs into digital records. Now, that is a time consuming process and also a cost consuming process. The technique sensitive, the sensors which we used, especially when we use your CCD sensors, since the area of actual recording area is much more lesser compared to the actual area of a CCD sensor which is in our hand. This is technique sensitive since we have to exactly locate that specific area of interest within this actual recording area, which comes with experience, and newbies do get a few amount of cone cuts or image losses or repetition of these images have to take place. Loss of breakage of sensors, another most important disadvantage, since these sensors are very sensitive to either heat or cold or electricity or a slight droppage of these sensors. The replacement of these sensors is one of a bigger headaches because of the high cost of these sensors. That is one area where we have to look into. Lack of universal use because of this, obviously because of these disadvantages. There's lack of standardization or a lack of total usage of digital imaging. So a person using a kind of digital image, if he wants to send this particular soft copy to another practitioner over a long distance. Now, if the other practitioner is not using the digital imaging, the basic purpose of him using a digital image to transfer these soft copies to other practitioner gets lost. So a widespread use and a standard protocol for usage of this digital imaging still has to be implemented. Now the infection control, one of the most important, they are compared to your IOPS, these sensors have to be repeatedly used. You don't use, it is not a one use sensors, it has to be repeatedly used on different patients. So infection control, strict hygiene protocols, strict barrier protections for the sensor, for the patient as well as the physician have to be followed up in digital imaging. So that brings us to the end of the next step of recording devices, your digital imaging. Thank you all.